Hey there, it's Dr. Jim. I have some really interesting information to share with you on an FDA approved THC CBD combination medicine called Sativex. Okay. Usually comes in an oral spray, but my topic is severe dementia, pain, and agitation. And I asked the question, can Sativex help? So, due to the sheer numbers of people who currently have dementia or they're going to have some dementia or dementia-like condition, like Alzheimer's disease, and especially those who will suffer from undiagnosed pain related to agitation, because there will be plenty of those, there is a real need for a safe and effective treatment, free of potentially life-threatening side effects that many psychotropic psychiatric medications come with. Recently, groups of researchers have examined the effects of a THC CBD-based oral spray called Sativex, and they found that it might be a safer treatment for both pain and agitation in severe dementia. This could be a very important breakthrough treatment. So, severe dementia, pain, and agitation. What's the connection here? Well, it's well known that over 80% of residents who live in nursing homes and who are diagnosed with dementia will experience chronic pain. And nearly 100% experience some type of neuropsychiatric symptom. And the main one is usually agitation. And agitation with moderate to severe dementia is very difficult to treat. Okay? This is significant. Why? Because that person's quality of life on a daily basis is affected deeply by disorders of thought, mood, and behavior. Alzheimer's, dementia. To make matters worse, individuals diagnosed with dementia are of advanced age and normally present with multiple co-occurring conditions like heart disease, stroke, and diabetes, making effective treatment even more difficult. The clinical picture becomes even muddier. Most nursing home residents with dementia unfortunately receive little to no therapy for pain. So this is a big deal. Now, currently, what types of medications are we using out there for dementia and agitation? And I've been in the field for decades. I worked very closely with geropsychiatrists for 7 to 8 years. Lots of medications enter the scene. New drugs are being prescribed all the time. So before the latest drug, Rexulti, and maybe you've seen the commercial, dementia with agitation, Rexulti, Rexulti, Rexulti. Before this drug came out, there was no dementia with agitation specific treatment. Therefore, healthcare providers turned to what? Antipsychotic medications. These were usually used off-label, meaning that they were not originally meant to treat dementia with agitation, off-label. Rexulti was originally prescribed for treatment-resistant depression. What is that? It's a condition where an individual is diagnosed with depression. They try one specific antidepressant medication for 30 days, 60 days, 90 days, and they don't get significant symptom relief. So their healthcare provider will discontinue that medication and prescribe a different type of antidepressant. And again, 3 30 days, 60 days, 90 days out, no relief. That's treatment-resistant depression. So Rexulti can help those people too. The problem, and this is a common problem with all prescription medications, the problem with Rexulti and antipsychotic medications of any type are the potentially dangerous, severe, and sometimes life-threatening side effects. And here's a list: risk of suicidal thoughts and actions, neuroleptic malignant syndrome, tardive dyskinesia, high blood pressure, induced diabetes, increased cholesterol, weight gain, compulsive behaviors, low white blood cell count, falls, seizures, fatigue, and the worst of all, death. Write it all in my article that you could find online too if you're a reader. Pass it on to a friend or a colleague. Might be helpful to somebody out there. Of special note, Rexulti comes with a black box warning. Here's the quote: increased risk of death in elderly people with dementia-related psychosis. Medicines like Rexulti can raise the risk of death in elderly people who have lost touch with reality, which we call psychosis, due to confusion and memory loss, or dementia. Rexulti is not approved for the treatment of people with dementia-related psychosis without agitation that may happen with dementia due to Alzheimer's disease. End of quote. And I found that on their website. So my question, just like in the very beginning, can Sativex help manage symptoms of dementia with pain and agitation? And if it can, this would be a great discovery, a great breakthrough. So I did my research, as I always do. It makes logical sense that if a treatment can reduce inflammation and pain, let's get those out of the way, agitation then associated with dementia, maybe it will diminish as well. That's the theory behind some current research on this topic. So, researcher Scuteri and others in 2022 reported this, quote, pain and NPS, neuropsychiatric symptoms, remarkably reduced the patient's HRQL, which is short for health-related quality of life, and contributed to increase risk of mortality due to inappropriate pharmacological treatments. Therefore, safer and more effective therapies are needed. End of quote. Another study by Christopher P. Elberton and others, his whole research team, in 2023, supported the use of Sativex as a potential alternative to traditional medications for dementia, agitation, and aggression for residents in nursing homes. Here's a quote out of that study. Although no statistically significant treatment effects were observed, indications of positive clinical effects were noted. These findings further support further investigation into cannabinoid-based therapies for agitation. End of quote. It should be noted that Sativex is currently licensed for the treatment of multiple sclerosis-induced spasticity. And I understand it can be rather effective, which is great. Bianchi and others in 2023 point out that pain might be associated with the overall deterioration of the individual's condition due to dementia, and this can be related to the onset or the worsening of behavioral symptoms like aggression and agitation. Optimizing pain treatment is the key here because it might reduce such behaviors and enhance overall quality of life. Non-pharmacological interventions like activities and social support, they do work for a while. They may work for a while. I have seen them up close work for a while. And the use of antidepressants, antipsychotics, and benzodiazepines unfortunately present too many possibly dangerous side effects life-threatening side effects as well. So medical cannabinoids might be a safer and more effective form of treatment. Finally, one more study to share with you. Chelsea and others in 2018, in their article, Cannabinoids for the Treatment of Neuropsychiatric Symptoms, Pain, and Weight Loss in Dementia. And that is another clinical problem and a quality of life problem. They reviewed studies that found positive results in the use of cannabinoid-based medications. Among their findings, decreased agitation, fantastic, improvements in sleep, wonderful, increased food intake, and healthy weight. Wonderful, wonderful findings. Even though some of these findings are not statistically significant, to shout from the rooftops, any help is welcomed. My final thoughts. Dementia and other like conditions affect millions of Americans and those from all around the world. Many co-occurring symptoms like memory impairment, loss of communication, agitation, and aggression make evaluating pain a very serious challenge. Although there are prescription drugs available for symptom management, they all have the potential for serious and life-threatening side effects, including death. It is therefore imperative to find a better natural cannabinoid-based treatment for these symptoms, alleviating side effects and improving quality of life. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com, or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.